Thank you for giving me this opportunity to see my daughter grow and ensure that she creates impacts in our society. Thank you so much for your generosity. Thank you, everyone.
So once again, on behalf of the Foundation for Cancer Care, I would like to say thank you for joining us. And I would like you to take a minute of your time now to look to the person to your side, to your left and to your right, and tell them welcome.
Well, thank you, ladies and gentlemen. We're very, very grateful that you honored our invitation and that you're here this evening. You all look fantastic. You look great. So, as I was thinking about a few comments this evening, my favorite African proverb is, if you want to go fast, go alone. But if you want to go far, go together. So that's something that really resonates with what we're doing this evening. So I want to thank everybody who has made this possible tonight. It's a very good cause. Anytime we have the opportunity to contribute to control of cancer in our community, it's a good thing. Right?
Yes, sir.
Cancer is a huge problem. It affects everybody in our society through family members, friends, personal challenges with the disease. But it's an opportunity for us to come together, raise funds, help people get cancer screening, help people prevent cancer, and if somebody has cancer anyway, be able to beat the disease.
This month is Breast Cancer Month. We're all wearing our pink ribbons. And it's not just a matter of wearing the pink ribbons for millions of women around the world. It is a huge burden. In advanced countries, they have a lot of hope because breast cancer, for the most part, is now virtually curable. But here in Nigeria, we still have a huge challenge. We have a huge challenge with the identification of women being able to come forward to get proper diagnosis. And even when they get diagnosed, the huge issues with stigma, the huge issues with acceptance by the family, the huge issues even with coming forward to get treatment. And when they want to come for treatment, there's a huge issue with affordability. Can they afford the treatment? And these are some of the challenges that this foundation seeks to deal with. And so I'd like to, on behalf of the Healthcare Federation of Nigeria, congratulate them for this fundraiser. And I would also like to lend my voice to theirs to say, please dig deep within your pockets, within your checkbooks, within your transfer banking accounts, your online banking accounts, and make that transfer and assist this project. Thank you very much.
In the year 2020, I was diagnosed with cancer. And it would have been far more difficult without the support of this foundation. I found a family in them, and it has been amazing. It's not just the illness that needs attention. You think about the mental, you think about the emotional, and even the financial challenges. And I'd like to say a very big thank you for this foundation for all that they have done. Thank you so much.
And I remember when I was training in medical school, we always thought that cancer care or cancer as a disease is something that doesn't face us in Nigeria. It's more of a Western illness. But over time, that has changed significantly. And in fact, right now, cancer is killing more people than HIV, tuberculosis, and malaria combined in our environment. So it really is something we need to work on. And the reason why the Foundation for Cancer Care is so important is because we know that in our environment, there are very few people that can actually pay for the treatment of cancer. Really, the cancer drugs are very expensive, the treatments are extremely expensive, so prevention is better than cure. When Lakeshore Cancer Center first opened about 10 years ago, the problem that we found was that so many patients were presenting to Lakeshore at a late stage. And so they would arrive at the clinic, and then their disease is so advanced that there was very little we could do for them, and unfortunately the outcomes were very poor. And then there were some who would present at the cancer center, and they couldn't even pay for treatment. I personally have seen some patients that they can't even pay for the tests for the cancer care, let alone the drugs thereafter. So what can we do about this? And it's because of this issue that the Foundation for Cancer Care was started.
And I rise up, I rise not today, I rise up.
So what inspired you to be here tonight for this fundraising gala?
It's personal. I'm a survivor. 3-4 years now. So this is very personal to me. I'm glad to be here. I'm happy to be here. And it has been amazing. I mean, Foundation for Cancer Care.
Well, being a cancer survivor, I thought it was, an important cause to support. So, I'm here because it's a very important thing, and I've gone through that experience, and I know how important it is to support, other people who are going through, cancer treatments or have just discovered they have cancer.
Okay, so
It's about the patient, actually. For us, we work at Lakeshore Cancer Center, but then, Foundation for Cancer Center is a sister company, and then all we do is support people, the less privileged, that are not able to afford their treatment. As we all know, cancer treatment is very expensive. So we are gathering here today together to make donations to support the less privileged, the people that are in the rural areas that can't even afford to do normal breast screening and other parts of the body screening to know if they have cancer or not. And for people that have cancers, right? It's
that's very
also a way of gathering donations for treatment for them.
Right. It's important to always celebrate things like this and honor people and make people know that you are together with them and inform people that we see what you're going through. You may not talk about it, but we're here, smiling in our trueness and our oneness and in unity with you.
Well, anything worthwhile is worth doing well, particularly when it's medical related. You're Nigerian, so I'm Nigerian. We know the challenges that are here. We know the deficiencies that exist medically. We don't have enough health centers, we don't have enough clinics, we don't have enough medical hospitals. Procedures here are still rare. So the good people here and the good people who are sponsoring this are making these things available. They are making it available to people, to a large extent, to some people who are less privileged. And there's no way you can support that.
I'm an oncology surgeon. So I have a working relationship with Lakeshore, and I'm passionate about looking after patients with cancer. And I know that access to quality cancer care can be a challenge. So any way of supporting patients to have access to quality care, I'm mandate to support them.
Okay, so what inspired you to attend tonight's fundraising gala? So I'll start with Mom.
Well, I'm on the board of the foundation, so I don't think I had a choice. So I'm supporting the board that I sit on, obviously for a very good cause.
Okay.
Yes.
All right, sir. And you?
I support my wife, so she's on the board. But then even the cause is very it's very dear to me as well. I've had family members that have had cancer, so anything that one can do to support the cause is always helpful.
So the organization, I know the work they do. They do a lot of good work, and anything anyone can do to support it, they shouldn't hesitate. So that's why I'm here.
Wow, that's awesome. So personally, sir, what does this cause mean to you?
I mean, I see cancer patients, I treat cancer patients, I know how difficult it is to get the level of care that is required in this environment. So when you have an organization that goes above and beyond to do that, it's what we need. So the more that we can get of this, the better.
Second artwork is for the family. This painting is a tribute to the relentless sacrifices mothers make to provide for their family.
125.
125,000 naira. Bidding price for this artwork, Storm, starts at 150,000 naira. 220,000.
300.
300,000 naira.
400.
Oh my God. 400,000. 600,000 naira to go. 470. Is there anyone in the house who can beat that? Sold. I'm going to India. Are you going to watch this slip? Thank you. We have a 2 million.
We're toasting to two things. We're toasting to more hope, more healing, and many more stories like that of Ngozi Clement sharing with us the impact of the work that we're doing. And congratulations on a wonderful event. And I'm charging every single person, please let it not stop here. Let's continue advocating. Let's continue supporting.